Welcome back to this special edition of 11 TV Hill. I'm Jason Newton, and joining us now is the Baltimore City Health Commissioner, Dr. Letitia DeRaza. And thanks for joining us tonight. I think that we need to get some base knowledge here. We hear the word opioid is thrown around. Let's tell people exactly what is classified as being an opioid.
Sure. Well, thanks, Jason, so much for having me and providing me with this opportunity to share what I hope is very helpful information. So opioids are a particular class of drug that are derived from what's called the opium plant. So they work on our brain in a very interesting way. When we take opioids, they help to relieve pain. So they are associated with a response that they have on what's called our dopamine receptors, and they help to alleviate pain. So this includes medications like your OxyContin, your oxycodone, Vicodin or codeine. These are all classes of opioids.
So they go in, they hit these dopamine receptors, and they do the job for people who may be in pain. But what makes them so addictive in the end?
Yeah, that's a good question. So again, they cause this release of dopamine, which is one of our pleasure one of our pleasure hormones, and that makes the body feel a lot more relaxed. Over time, it takes a lot more to get that same level of relief or that same level of pleasure. And so over time, many individuals start to take more and more to try to achieve the same effect.
Give me some strategies. If a parent came to you in your current role as a city health commissioner and they're looking to send that strong, clear message of prevention to their children, what's a strategy that you would suggest to them?
Sure. Well, first, I would say start having talks about drug use, illicit substance use early, as early as late elementary age and certainly in middle school. Talk about substances and what substance use disorder is, and also provide healthy outlets for that child. I think oftentimes children are looking to their parents as the moral compass. Even if they seem to turn to their friends, trust me, they're watching you and they want to know what you think. And that does help to guide a lot of their decisions. So I would say have those really truthful and honest conversations about the dangers of drugs.
And I think that danger becomes important with so many kids who are doing sports now, and some injuries may occur. I know my son has been to orthodontist, and you might have some pains there. And sometimes the doctor does actually prescribe this for a child. So how should you handle it when it's actually a prescription drug that your child has been asked to take by the doctor?
Yeah, that's a great question. So again, I think it's one, understanding and recognizing that even though it's a prescription drug, there is potential for abuse or misuse. So, obviously, if it's a teenager, you want to try to establish some level of trust, but have that open dialogue. Talk to them about the fact that this could be a habit-forming drug. Ideally, that provider, the person who's prescribing it, is not prescribing a large amount. But have that conversation with your child. Talk about when to use it. When is it appropriate to use it? If you're using it at this time, when should I be concerned? So I think having those conversations with your teen and with the physician or whoever's providing it is paramount.
Parents have so much on their radar right now, whether it's social media or like now we're talking about opioids. Are there other substances that you think parents should keep an eye out for when dealing with them and your children?
Sure. So I think that we certainly hear a lot about opioids, but marijuana use is still extremely common among young people, as is alcohol use, so early and illegal alcohol use. So those are substances, again, that you should be having those conversations with your child early about the dangerous implications and effects of using these drugs inappropriately.
Let me sneak one more in. Just talk about Baltimore in particular right now as we deal with this problem. What are some things that the city is doing, at least out of your office, to help educate and get people from being misusers?
Yeah, that's a great question. So we have an Office of Opioid Prevention and Response. And so one of the things is we lead coordination of some of the city's efforts around opioid overdose prevention. So we have a directorate. We meet with multiple other agencies. So it's very much a team effort. We meet with partners at Behavioral Health System Baltimore, our partners at the DEA, our partners at Baltimore Police Department and Fire Department to understand what are current trends and where are additional resources needed, where in the community is more naloxone needed, where is more training and education needed. We talked a lot about making sure that parents talk with their child. We've also worked within city schools to provide education around opioids and drug use in general.
All right, Dr. Letitia DeRaza, thank you so much for joining us. We appreciate all your knowledge and things you're doing here in Baltimore. And also look forward to seeing you after the program. She'll be joining us for our live discussion that'll follow the program. They'll be on Facebook. Thank you again.
Great. Thank you.
Mindy, over to you.
Thanks, Jason. The opioid epidemic not only has an adverse effect on our public health, but it also adversely impacts our public safety. To explore the impact of the epidemic on criminal activity, we have with us two local law enforcement officials who are on the front lines. Please welcome the Police Commissioner of the Baltimore Police Department, Michael Harrison, and Assistant Special Agent in charge of the DEA Baltimore District Office, Orville Green. Welcome, gentlemen.
Thank you.
Good morning. Thank you.
Let's start with the question for both of you. What's law enforcement finding in terms of criminal activity in the peddling of opioids? Let's start with Commissioner Harrison. What are you seeing?
Well, we think that most of these drug organizations or crews, if you will, are monopolizing certain geographies. And because heroin traditionally has been here for a long time, but now fentanyl is becoming more prevalent, it's creating a very competitive market. And because it's so lucrative, violence is often associated with the competitiveness of the geography, who's allowed to sell, who's allowed to make money. And that violence kind of spills over into other areas. And then there are retaliatory acts because of these previous bad acts. And so we know we see an increase in violence across our city that's tied directly to the sales and the resales of both heroin and fentanyl, now more fentanyl, but then we see a lot of retaliatory bad acts of violence, both shootings and murders, because of the lucrativeness and the competitiveness of the market on the streets of Baltimore.
Mm-hmm. Agent Green, what is your agency seeing?
Well, I agree with the commissioner. The distribution of drugs is tied in Baltimore is tied directly to street violence, and I'm sure Commissioner Harrison will attest that a significant number of the shootings and homicides in Baltimore involve drugs in some aspect. The commissioner and I are definitely in agreement, and work very closely in combating the distribution of illegal drugs and the drug-related violence associated with it. We recently stood up the Baltimore OCDF Strike Force, whose mandate really is to address illegal drug trafficking in Baltimore and the surrounding counties, as well as the violence that's associated with it.
And there is a market for these drugs. Commissioner Harrison, what's the degree of usage in Baltimore City and who is using?
So what we believe, based on data we collect from EMS, from working with our federal and state partners, from arrests we make, suggests that it's black males, primarily black males between the age of 51 and 60 who are overdosing. That's not everybody who's using. That's the demographic of people who we think make up a large percentage of non-fatal and fatal overdoses. Certainly, the demographic spreads far beyond that demographic. It's much younger, it's much older, it's both male and female. But for non-fatal and fatal overdoses, we are seeing a large chunk of the demographic being black males between 51 and 60, because we think those are the long-term hardcore users who have been addicted for years or for long periods of time and are hardcore addicts. And because of that, we see that that's the core demographic of overdose victims, like I said, both fatal and non-fatal. Certainly we see people overdosing in younger age groups, both male and female, but in our responses and data we collect, it points to that core demographic.
Agent Green, what other drugs are in play along with the opioids?
Well, cocaine, methamphetamine. So much we don't see a lot of meth here in Baltimore, crystal meth in Baltimore, and also heroin. But what's interesting is we've found fentanyl mixed into cocaine, methamphetamine, and what we expect, obviously, and what we see a lot in heroin as well. But for fentanyl to be mixed also in cocaine and in crystal meth, that was something that was new to us with respect to that particular dynamic. This is just the profit margin as well with respect to fentanyl is pretty high, and that's one of the reasons why drug dealers get involved with distributing fentanyl.
And that is dangerous anytime you mix fentanyl with these other drugs.
Yes, absolutely. Fentanyl is a narcotic, obviously very potent narcotic that's used to treat severe pain. there's a high risk of addiction as well as dependence. And, approximately 2 milligrams, you're talking about granules, can be fatal.
A lot of people have leftover medications, prescription drugs in their home. Talk about ways people can safely dispose of those. DEA conducts drug take-back days. Tell us more about that program.
Okay, so DEA has 2 drug take-back days annually. It's usually in April and October. Take-back aims to provide a safe, convenient, and responsible means of disposing of prescription drugs, while also educating the public on the potential for abuse of medication. Just this past October, we hosted the second Take Back Day this year, and we collected approximately 1 million pounds of prescription drugs, which I think is a pretty good thing. Now, for the rest of the year, DEA has authorized collectors who provide year-round drop-off at locations that the public can dispose of unwanted pharmaceuticals. And for more information, visit DEA.gov.
Commissioner Harrison, anything you want to add before we go?
Yeah, that's very important because each one of our police districts has a secure drop box. And although we participate with DEA in its drug take-back days, at any time, people can go to any of your 9 police districts, and you can find the locations on our website and safely drop off your prescriptions, because we have drop boxes that are emptied and then that's turned over to DEA. But we can secure that in our police stations at any time in a very safe way. So people should feel free and comfortable going to our police stations to turn over those unused prescriptions.
Very good. Commissioner Harrison and Agent Green, thank you so much for joining us tonight. We appreciate your time. Up next, we'll talk with an Anne Arundel County man on the front lines after losing his brother to the opioid epidemic. His message to families dealing with a similar situation when our special edition of 11 TV Hill continues. Stay with us.